When it comes to cancer, Professor Sean Holt is on a mission.
And he really talks about how the quacks preyed on him.
He wants you to know about complementary therapies, the ones outside the mainstream.
Most of them are absolute garbage. But hidden in there are some very, very good and useful therapies.
But not very useful, he says, is intravenous vitamin C.
There's no good evidence at all that it can help people. If I had cancer, I wouldn't have high-dose vitamin C. I think there's more harm than benefit.
The research says there's no evidence that vitamin C can either cure cancer or help prolong the life of a cancer sufferer.
Exactly.
But people are taking vitamin C, and they say they're feeling better for it.
Yep. Well, sometimes we can be fooled by how we feel. So I'm sure that they do feel better. I'm not questioning that. But the problem is, it could be something else that's doing it. It could be some other treatment. It could be the weather. It could be they've been on holiday. It could be the disease, which will probably go up and down like this.
Even the Otago University research, he says, needs to be treated with caution.
It showed a link, which is great, and you probably appreciate there's a link. I mean, vitamin C is very important. A couple of hundred years ago, more sailors died of vitamin C deficiency than died in the naval battles. It's hugely important, of course it is. But that's such a long way from being a treatment that's going to help people with cancer.
What's more, he argues the intravenous vitamin C could be risky.
By harming the kidneys and maybe even interfering with the standard chemotherapy treatment.
Is there evidence that it can harm you?
There is. It's not compelling, but there is some evidence. And sometimes things aren't totally clear-cut, and the harm from vitamin C isn't, but there's enough there to worry me. When you balance that against the fact that there's no proof whatsoever that it helps, then it's certainly not recommended.
If someone watching right now is taking vitamin C intravenously, are you saying stop taking it?
My recommendation is to stop that, because I don't think it's helping you.
So
we put that to cancer patient Kurt Villinger.
Yeah. Well, that's his own opinion, and I feel when you're in a position like this, anything helps.
And Graham Gage's reaction?
I don't know whether vitamin C is solely responsible for me feeling well or not, but I'm convinced enough to keep going with it. And being as I'm inside this body, it's got me convinced.
You have quite
and the same goes for Graham's doctor.
How sure are you that vitamin C is the way to go?
I'm very sure it's a way to go, because what I've observed from giving it to patients, it has produced benefits for them.
Do you sleep soundly knowing that you've administered some of your patients with intravenous vitamin C?
I do. I think that in the future evidence will support its use, and we just have to wait for that to come.
So are you taking a punt?
I think it's a qualified punt.
But another doctor who sees cancer patients every day
come through, come sit down.
won't take the punt. Waikato oncologist Michael Jameson.
I have to say, over the last 18 years, I have not seen any good evidence that vitamin C has a dramatic effect. People coming back and saying, my cancer's gone, or it's half the size it was, or things like that. So if it was as good as many of its proponents say, then it should be obvious.
Over those 18 years, how many patients have you seen who've used the vitamin C?
The ones who've told me about it are probably a few dozen. The ones who've probably had it without telling me are probably several hundred.
The vitamin C might boost your energy, he says, but anything more than that is unproven.
So it's not a question of whether vitamin C can do anything useful at all. I think the evidence is out there that, yes, it can make some modest differences, but people are having it hoping that it will, firstly, get rid of their cancer, B, if it doesn't get rid of their cancer, slow it down, and C, use it to help them while they're having chemotherapy or radiation so they get less side effects in the process. We don't have any good evidence so far that it does any of those things.
I will always miss you. I love you. I love you, my brother of mine.
3 weeks after we interviewed Kurt Villinger, the leukemia claimed his life at the age of 20.
It makes me feel so happy that you are no longer in any pain.
Kurt's illness was already well advanced when he started on the intravenous vitamin C.
I'm not saying it's a potential cure for me, but it's giving me the energy that I need to just live life, and I think that's a good thing, yeah.
For the cancer patients we've met, intravenous vitamin C has brought comfort and hope. But we don't have evidence it's treated the cancer as such. So what do we make of this? Well, the medical experts we've spoken to agree on one thing. If you're thinking of taking it, consult your cancer doctor first. Of course, what would settle the debate is proof. Scientific proof.
But we need further research to determine how we could deliver the vitamin C to the cells, whether it's a good idea or not, and to measure the outcomes of doing that.
Scientist Margriet Vissers found vitamin C might control the growth of a tumour. Now she wants to test this further, not in test tubes, but on people.
If you could start tomorrow, how long would it take?
A year?
Well, you'd like some money from the government.
We would. That would be very nice. But we're in the pool with everybody else, you know, applying for grants.
Pulses ran, so we're probably going to change the battery in the Micron.
And what of Graham Gager, still battling prostate cancer? He loves his motorsport, as does his brother.
Slack on the change, will be okay there?
Yeah, it's not bad.
He believes intravenous vitamin C helps him make the most of life. He's happy for that.
To me, it's all about enjoying my family, my 10-year-old daughter, my beautiful wife, and staying fit as I can, and the vitamin C helps me do all that. And if it's going to slow the cancer down or cure me, great. I'm in for that. That'd be great.